The #1 birth defect for all children is heart problems.
The children that we take care of over here are very complex babies with very complex conditions.
Pediatrics is specialized. The things that we do, the size of catheters, the types of catheters, and throughout the hospital, the instruments that are used in surgery are different than an adult hospital.
What we do with our heart center is we actually collaborate, putting our minds together to solve patient problems.
So the team we have here at Bonheur is a team of surgeons, cardiologists, anesthesiologists, intensive care doctors, and then all the nurses and associates that go along with all those folks. And it takes a team approach with advanced cardiac care these days to be successful. If we're coming in here to close a hole in the heart or fix a valve, we see that it's fixed right away. And for most of those patients, they actually feel better within a day or two. So when you see them and follow up at a week or two and they can tell you they feel better, I mean, that's very, very rewarding.
Technology helps us to do things which we would have not done a few years ago. Having new technology allows us to push our limits.
The reason this technology matters is because it's actually going to improve lives. It's going to improve outcomes. It's going to make people either keep them healthier or get them better faster.
The children will continue to have heart disease and have special needs. And we're going to continue to see children with complex heart disease. And so it's incumbent upon us to have the technology to be able to make a correct diagnosis, to evaluate them properly, and to have the people to take care of them.
It's exciting to know that we were able to make a difference in the lives of these babies.
Bonheur matters because they've taken a situation that started out as hopeless, and they've added hope to it. And the hope builds as the treatment continues.